Why bruises show up faster after 50? Most people think bruises only show up when you hit something hard. You bump your arm against a door. You knock your shin on the coffee table. You carry grocery bags, do yard work, or lean your forearm against the countertop. Then suddenly there it is, a purple mark that looks much worse than the bump felt. And after 50, this can feel confusing. You may think, I barely touched anything. Why does my skin bruise like that now? Here is where people get fooled. Faster bruising after 50 is not always a sign that something dangerous is happening. But it is also not something to ignore completely. Bruising is your body's way of showing that tiny blood vessels under the skin have leaked blood into the surrounding tissue. The question is why those vessels are breaking more easily, or why the bruise looks bigger than it used to. And the answer is usually not just one thing. After 50, the skin becomes thinner. The protective layer of fat under the skin can shrink, blood vessels become less cushioned, sun damage from decades earlier can weaken the skin and supporting tissue, medications may change the way blood clots, nutrition, liver function, platelet health, alcohol use, and inflammation can also affect how easily bruises show up. So the real message is this: bruises after 50 are often common, but the pattern matters. A small bruise on the forearm after a bump may not be alarming, but bruises that appear without any clear reason, bruises that are getting more frequent, bruises with bleeding gums or nosebleeds, bruises with extreme fatigue, weight loss, fever, blood in urine or stool, or tiny red-purple dots on the skin should be checked. Because sometimes a bruise is just a bruise, but sometimes it is a clue. The first reason bruises show up faster after 50 is thinner skin and less natural cushioning. When you were younger, your skin had more thickness, more elasticity, and more padding underneath. That padding helped protect tiny blood vessels from minor trauma. But with age, the skin gradually becomes thinner and the fatty layer that cushions blood vessels can decrease. Mayo Clinic explains that older adults bruise more easily, partly because skin becomes thinner and loses some of the protective fatty layer that cushions blood vessels. That means a bump that used to leave no mark may now break small vessels under the skin. You may not even remember the bump because it felt too minor. But your skin remembers it. This is especially common on the hands, forearms, and shins, because these areas are exposed and often take small hits throughout the day. You reach into a cabinet, you carry a laundry basket, you brush against the doorway, you rest your arm on a hard table. None of these feels serious, but the skin is less protected than it used to be. That sounds small, but it matters, because many people after 50 assume they are suddenly becoming fragile. But often the body is simply showing the same daily bumps more visibly than before. The second reason is sun damage from years earlier. This is one of the most overlooked causes. People think sun damage only means wrinkles or dark spots, but long-term sun exposure can also weaken the deeper support structure of the skin. The skin becomes thinner and more delicate. Blood vessels lose some support. The result can be large purple patches, especially on the forearms and backs of the hands, even after very minor trauma. This is often called actinic purpura or senile purpura. The name sounds frightening, but it is usually benign. MST manual describes senile purpura as a condition in older adults where dermal tissues atrophy and blood vessels become more fragile, leading to dark purple bruises, often on the hands and forearms. This is where people get fooled. They see a dark purple bruise and think something terrible must be happening inside the body. Sometimes it really is just fragile sun-damaged skin. But the key is location and pattern. If the bruises are mostly on sun-exposed forearms and hands, appear after minor bumps, and slowly fade, that pattern is often related to aging and sun damage. But if bruising is widespread, spontaneous, painful, paired with bleeding elsewhere, or appears suddenly after a new medication, that is different. That should not be dismissed as skin aging. The third reason is medication. This is a major one after 50, because many people start taking more medications for blood pressure, heart health, pain, arthritis, sleep, inflammation, or circulation. Some medications do not make you bruise because they damage the skin. They make bruises larger or more noticeable because they affect clotting. If blood does not clot as quickly, more blood can leak under the skin after a small vessel breaks. Aspirin, blood thinners, antiplatelet medicines, and some anti-inflammatory pain relievers can contribute to easier bruising. Corticosteroids, whether oral or sometimes long-term topical use, can also thin the skin and make bruising more likely. Cleveland Clinic notes that older adults, people taking certain medications, and people with vitamin deficiencies or blood disorders may bruise more easily. This is where people make a dangerous mistake. They see bruises and stop their blood thinner or aspirin on their own. Do not do that. If your doctor prescribed a blood thinner, aspirin, or antiplatelet medicine for your heart, stroke risk, clot risk, stent, atrial fibrillation, or another condition, stopping it suddenly can be dangerous. The right move is not to panic and quit. The right move is to call your clinician and say, I am bruising more easily. Is this expected with my medication? Do we need to check anything? The same applies to frequent ibuprofen or naproxen use. Many people take these for joint pain because they want to stay active. But if bruising increases after using them more often, that pattern matters. Your skin may be telling you your medication routine needs review. The fourth reason is slower repair and weaker tissue support. A bruise is not just a mark, it is a cleanup job. When small blood vessels leak, your body has to break down and clear the trapped blood. That is why bruises change color over time. Purple, blue, green, yellow, brown, then fading. After 50, tissue repair can be slower. Blood vessels may be more fragile. Skin recovery may take longer. Inflammation may linger. This does not mean the body cannot heal. It means the healing process may not be as fast or invisible as it once was. And this is why nutrition matters more than people think. Your body needs protein to maintain tissue repair. It needs vitamin C to support collagen and blood vessel strength. It needs vitamin K for normal clotting. It needs iron, B12 and folate for healthy blood cells. Deficiencies are not the most common cause of bruising, but they can contribute, especially if your diet is limited, appetite is poor, digestion is impaired, or you take medications that affect absorption. This is where people get fooled. They buy a cream for the bruise, but the deeper issue may be that the body does not have enough building material to repair tissue well. That does not mean you should start high-dose supplements blindly. Too much of some supplements can interact with medications, especially blood thinners. But it does mean your overall nutrition matters. If bruising is increasing along with fatigue, weakness, pale skin, weight loss, poor appetite, numbness, or mouth changes, it is worth asking your clinician whether blood counts and nutrient levels should be checked. The fifth reason is alcohol and liver stress. This is another hidden reason people rarely connect to bruising. Your liver helps make clotting factors, which are proteins that help your blood clot properly. If the liver is not working well, clotting can be affected. Heavy alcohol use can also increase fall risk, worsen nutrition, affect the liver, and interact with medications. Over time, this can make bruising more likely or more concerning. This does not mean every bruise is a liver problem. Most bruises are not, but bruising together with yellowing eyes, dark urine, pale stool, swelling in the belly or legs, unusual fatigue, poor appetite, confusion, or easy bleeding deserves medical evaluation. This is where people get fooled. They separate the symptoms. They think the bruise is skin, the fatigue is age, the swelling is salt, and the poor appetite is stress. But the body does not work in separate boxes. When bruising comes with other body-wide symptoms, you have to look deeper. The sixth reason is platelet or clotting problems. Platelets are tiny blood cells that help stop bleeding. If platelet numbers are low, or if platelets are not working properly, bruising can become easier. Clotting disorders can also make bruises larger, more frequent or more spontaneous. NICE lists platelet disorders, coagulation disorders, vitamin K deficiency, corticosteroids, antiplatelets, anticoagulants, and NSAIDs among causes that can be considered when evaluating bruising. This is not the most common explanation for every older adult with bruises, but it is important because it changes what you should do. If you notice lots of bruises with no injury, tiny red or purple dots called petechiae, bleeding gums, frequent nosebleeds, very heavy bleeding from small cuts, blood in urine or stool, or bruises that appear suddenly and dramatically, do not treat it as normal aging. That is your body asking for medical attention. The seventh reason is diabetes, circulation changes, and small injuries you do not feel. After 50, some people have reduced sensation in the feet or legs because of diabetes, prediabetes, neuropathy, or circulation problems. If sensation is reduced, you may bump your leg and not notice. You may wear shoes that rub. You may develop small injuries that become bruised or discolored before you remember any trauma. Blood sugar problems can also affect healing. Circulation problems can slow tissue repair. If you have diabetes and notice bruises, sores, blisters, or wounds on the feet or legs that are slow to heal, that deserves attention. Most people think bruising is only about blood, but sometimes bruising is also about sensation, skin quality, and healing capacity. This is especially important on the lower legs and feet. A bruise on the shin from a clear bump may be simple, but a dark area on the foot, a wound that does not heal, new swelling, redness, warmth, severe pain or color change should be checked, especially if you have diabetes or poor circulation. Now let's talk about the kind of bruising that is more expected after 50. If bruises show up on the forearms, hands or shins after minor bumps, if you take aspirin or a blood thinner, if your skin is thin and sun damaged, and if the bruises slowly fade without other symptoms, that may fit a common aging pattern. But expected does not mean meaningless. It still tells you your skin and blood vessels need more protection. The goal is not to live in fear of every bruise. The goal is to reduce unnecessary injury and notice when the pattern changes. Protect your skin like it is valuable, because it is. Wear long sleeves when doing yard work, cleaning, moving boxes, or handling pets. Use gloves for gardening. Keep walkways clear. Add padding to sharp furniture corners if you bruise easily. Use good lighting at night. Be careful with ladders and uneven ground. Wear supportive shoes to reduce trips and falls. And do not underestimate sun protection. Sun damage is not only about appearance. It affects the structure of the skin. Daily sunscreen on exposed arms and hands, protective clothing, and avoiding repeated sunburns can help protect the skin you still have. Also, review your medication list. Many people do not think of over-the-counter products as real medicine, but aspirin, ibuprofen, naproxen, herbal supplements, fish oil, ginkgo, garlic supplements, and other products may affect bleeding or bruising in some people, especially when combined with prescription blood thinners. Do not stop anything important without medical advice, but do tell your clinician everything you take, including supplements. Most people miss this because they say, it's natural, but your blood does not care whether a substance came from a prescription bottle or a health store. It cares what the substance does. Now, when should you worry? You should get checked if bruising suddenly becomes much worse, if bruises appear without any known injury, if bruises are very large or painful, if you have frequent nosebleeds or bleeding gums, if you see blood in urine or stool, if you develop tiny red-purple dots on the skin, if you feel unusually tired or weak, if you have fever, night sweats, unexplained weight loss, or if bruising begins after starting a new medication. You should also get medical help after a significant fall, head injury, or bruise with severe swelling, numbness, increasing pain, or trouble moving the area. And if you are on a blood thinner and hit your head, even if you feel okay at first, ask your clinician or emergency service what to do, because bleeding risk can be higher. This is not to scare you, it is to separate common bruising from warning bruising. There is a difference between a thin skin bruise on the forearm and a new pattern of unexplained bruises all over the body. There is a difference between a small bump mark and bleeding gums plus fatigue. There is a difference between a medication-related bruise that your doctor expects and bruising that signals a dose, interaction, or clotting problem needs review. The pattern is the story. So what can you do starting today? First, stop blaming yourself. Bruising after 50 is often not because you are careless. Your skin and blood vessels may simply be less protected. Second, protect your skin from minor trauma. Long sleeves, gloves, good lighting, safer furniture edges, and fall prevention can help more than you think. Third, nourish the tissue. Eat enough protein. Include fruits and vegetables for vitamin C and other nutrients. Include leafy greens if appropriate for you. But if you take warfarin or another medication affected by vitamin K, do not suddenly change your intake without medical guidance. Consistency matters. Fourth, review medications and supplements. Ask your clinician or pharmacist whether anything you take could be increasing bruising. Do not stop prescribed blood thinners on your own. Fifth, track the pattern. Where do the bruises appear? How often? Do you remember bumps? Are they getting larger? Do they take longer to fade? Are there other bleeding symptoms? Did it start after a new medication or supplement? Are you more tired than usual? That information can help your clinician decide whether reassurance is enough or whether testing is needed. And finally, do not ignore your skin just because you are older. Aging is real. Skin thinning is real. Sun damage is real. Medication effects are real. But deeper problems can also be real. The smart approach is not panic and not denial. It is curiosity. A bruise is a message written under the skin. Sometimes the message says, you bumped your arm, and your skin is thinner now. Sometimes it says, your medication makes bleeding show more easily. Sometimes it says, your body needs a closer look. After 50, bruises may show up faster because the cushion is thinner, the vessels are more fragile, the skin has more sun damage, Medications are more common, and healing may be slower. But your job is not to fear every purple mark. Your job is to notice the pattern, protect your skin, review the risks, and get checked when the bruising does not make sense. Because sometimes a bruise is just the story of yesterday's bump, but sometimes it is the first visible clue that your body needs help before a deeper problem gets louder.